Lithium is one of those minerals that barely get talked about, but it's surprisingly important. And if you ever struggled with anxiety, mood swings, or brain fog, it's definitely something worth looking into. In this video, I want to break down what lithium is, how to take it safely, and what side effects to watch out for. Okay, let's start by talking about what lithium actually is. It's a naturally occurring metal and trace element. It's found in our Earth's crust and therefore in our food, especially if you're eating things like cereals, potatoes, tomatoes, and cabbage. Some mineral waters also contain lithium, but the amount varies a lot depending on where you live, because it all depends on soil quality. People in certain regions get a lot more lithium just from their drinking water, and I will talk about this more in a second. Even though it's not officially labeled as an essential nutrient, lithium has a clear role in brain health. One of the things that it does is that it helps regulate how sodium flows through your nerve cells. This matters because sodium triggers nerve activity, and lithium helps keep that activity from going into overdrive. That's why it's considered a natural mood stabilizer. There are even studies showing that higher levels of lithium in drinking water are linked to lower rates of depression, suicide, and Alzheimer's. So it's definitely not just some fringe supplement, and has been used in traditional medicine for decades. The problem is that it's mostly been used in extreme doses, hundreds of milligrams, to treat serious mental health conditions like bipolar disorder. And those high doses can come with intense side effects like organ stress, inflammation, and tissue damage. Of course, that's not what we're talking about here. In this video, we're focusing on low to normal dose lithium supplements to get the benefits without the heavy side effects. The most common supplement type that you will find is lithium orotate, which is lithium bound to orotic acid. Most low-dose supplements range from 1 mg to around 20 mg, and most people usually start with 1 to 3 mg per day and then work their way up. The changes that you will notice will probably be subtle at first. Things like feeling calmer, less agitated, and more mentally balanced. It's especially helpful if you're dealing with anxiety, stress, or even mild depression. The goal is to basically help smooth out mood swings and make you more resilient during emotionally intense times. Besides lithium orotate, there are also two other interesting forms of supplements that you should know about. One is ionic lithium, where lithium chloride is dissolved in a liquid. This will raise absorption and make it more potent. Of course, you can also use it to start at a low dose and then build up to a therapeutic dose by just increasing the drops that you take every day. The other interesting form I want to talk about is plant-based lithium. This is a very unique form made from vegetables that are grown in high-dose lithium soil. This form is better absorbed and utilized than normal lithium supplements because it's what our body is used to. Unfortunately, this type of lithium supplement is fairly difficult to get. I recorded a video a while ago on how I used it for lithium microdosing, so make sure to check it out if you're interested. In terms of how and when to take it correctly, lithium is usually recommended to be taken with food, especially if you're taking lithium orotate, just to reduce the chances of stomach upset. Because it's calming, some people like to take it in the evening to help them wind down, but others feel best when they take it in the morning to stay balanced throughout the day. So you will want to try out what works best for you. Again, start with a low dose of 1 to 3 mg and work your way up. In terms of side effects to watch out for, the most common ones are digestive issues, mild headaches, or feeling a bit sluggish. If that happens, it usually means that your dose is too high or that your body isn't processing the lithium well. Also keep in mind that you don't want to be dehydrated when taking it. Lithium can affect how your kidneys handle sodium and water, so make sure you're drinking enough water. Also, if you're already on medication, especially if it's medication for your thyroid, kidneys, or brain, definitely talk to your doctor before taking it. All in all, lithium is a very interesting trace mineral that especially supports your brain health. If you live in a region that is known for having low lithium water, definitely look into this. Same if you are having any of the symptoms that we talked about or are looking for any of the benefits that I mentioned in this video.